Hello, everyone. My name is David Sotelo, and today I will be talking about cataracts. It is a medical disease that occurs within the eyes or your lenses of your eyes. The reason why I'm talking about cataracts today is because my cat Chiwiwi has cataracts herself. As you can see in the photo, her left eye has this very grayish whitish pigmentation, while her right eye has her normal colorings of like a very dark black. That white pigmentation right there is the cataracts. Now, cataracts comes from the medical or the definition from a Greek word "kataraka", meaning waterfall. This is because the term is pertaining to how the coloring of cataracts relates to the colors that a waterfall makes with like that whitish grayish color. Unfortunately, I couldn't find the prefix, suffix, or the combining forms for that word, but I was able to find the Greek definition, which did point out a lot of help to relate to how it pertains to that cataracts. Aside from that, the fact about cataracts is cataract surgery has been a very known practice as far as 6th century BC from a procedure called couching, where a patient is placed onto a couch, obviously, laid flat on their back, and allows the doctor to use this thorn-like needle to dislocate the cataract lens to allow the person to gain some form of their sight back. Since the advancement technology was very low, it wasn't as effective as it should have been. It had some effect and allowed some people to gain back some of their sight, but not to the full extent as they would have liked. But it did help. Cataracts is when the proteins within the eyes start to break apart, deteriorate, and then they start forming up together and creating these clumps in your eyes that causes this grayish white pigmentation that causes cataracts. Cataracts may be caused by a variety of ways, whether it's injuries, genetics, old age, UV lights, smoking, a whole variety of different ways cataracts can be caused. A way to get tested for cataracts is by an examination called the slit lamp examination. The slit lamp examination is when the doctor asks you to place your head onto a headrest where they would shine this very thin light into each of your eyes. And although it is very uncomfortable to go through that procedure a little bit since that light is very bright, it allows the doctor to get a full view of how your eye looks and to notice if there's any problems with your eyes or any like signs that your eye could be having some form of disease or um, any problems like cataracts, if there's any gray pigmentation, for example. Although there is cataracts has been a very wide known thing, there is no medical medication that can really help with cataracts. However, there is a medical procedure called cataract surgery that helps deal with that. Cataract surgery is when the doctor first places the patient in an anesthetic. This numbs the patient's eyes but does not put the patient to sleep. So the patient is awake for the procedure, however, they will not feel none of it. Then the doctor will make an incision into the patient's eyes that will allow this lens to be allowed to reach the lens that is affected by the cataracts. Next, the doctor will use a device called the phacoemulsifier to break apart the cataract lens and to extract it by sucking it out like a little vacuum. Once that is all done with, the doctor brings out an IOL or intraocular lens to replace that cataract lens. Eventually, after that, the doctor sews up that incision with a variety of different ways to allow the person to heal and to gain back their sight. I hope my presentation about cataracts allows you to understand it more and to know that if you do ever come across cataracts, there is always hope to get it treated. Thank you so much.